Can ADHD be treated, and if so, how? Good news is, yes, it can. And there are two routes for treatments. This is often the case in psychiatric illness. There is the therapy route, which is talking therapy, so speaking to a therapist once a week, maybe more, maybe less, for a specified amount of time, or for longer periods of time. And discussing symptoms, symptom management, how to adapt your symptoms to your everyday life, how to improve your functioning, talk about your issues in terms of how your symptoms are impacting on your work or your friendships or your relationships or your academic work. And this can be a really useful route for some people, and especially in children with who are diagnosed with ADHD, it's often preferred that they go down the therapy route of treatment before they go down the medication route, which is much more mainstream and popular. So let's talk about medications. Medications are available for ADHD, and they are mainly stimulant medications. This isn't necessarily something you need to be completely aware of, but just for interest, the most common are Ritalin, Adderall, and Elvance. So they're stimulant medications, and they essentially reduce symptoms of ADHD like lack of ability to concentrate, they help people focus, and they help people function in general. And as you can see here, they either come in stimulants or non-stimulants. Stimulants are more common, and scientifically they increase the production of chemicals in the brain that help with thinking and attention, which are the main issues with ADHD, right? So it's an attention deficit disorder. That is precisely what it means. So there's a theory that people with ADHD have a dopamine deficit in their brain. They don't produce enough dopamine, or the dopamine that they do produce isn't used in the brain in the correct way. These drugs basically fix that problem. So you've got talking therapy and you've got medications, and they both have scientific, good quality evidence for them being effective treatments. So therefore, we might not know exactly what the causes of ADHD are, but we do know that it can be treated, or at least the symptoms can be managed. And I think this is an important point to make, is that ADHD, unlike something like depression or anxiety, is a condition that you have for life. So once you're diagnosed with ADHD, it's a lifetime diagnosis. So when we say, can it be treated, we're not saying, can it be cured and it will disappear completely. We're saying, can the symptoms, things like inattentiveness, lack of ability to focus, difficulty organising things, hyperactivity, etc., those symptoms can be managed or reduced to a level of normal human functioning, either by therapy or by medication. So yes, we have treatments, but we don't have a cure, if you see what I mean. And that's important because it's a lifetime condition. So again, let's think about that. Can we cure a character flaw? Can we cure ADHD? We can treat it, yes, but can we cure it? That's up for debate. And that leads us on to our next question, which is, with ADHD in mind and what we've just learned about ADHD, how we treat it, how is there a cure for it? What are the causes of it? What are the symptoms of it? Then can we use this as a sort of case study into how to distinguish between what is a psychiatric illness and a character flaw? And these are the three ways that I would suggest you go about trying to differentiate between the two.